I'm going to stop.
Okay, so hello everyone out there. I think we're still waiting on some people to join. So it's only just gone 1 o'clock. So we might just give it, we'll give it 30 seconds to a minute, and hopefully more people will jump on board so that they get the start of the presentation. Can you see people jumping on board? Excellent.
This Teams as well.
Okay, we might get started. A very good afternoon to everyone, and welcome to Empower's Lunch and Learn session today. If you're in Melbourne, stay cool because we're heading for a top of a mild 38 degrees. Whew, pretty hot. So I'm here to talk during your precious lunch breaks all about managing chronic pain with massage therapy. And I'll just start with an acknowledgement to country. In the spirit of reconciliation, Empower Healthcare acknowledges the traditional custodians of the country throughout Australia and their connections to land, sea and community. We pay our respect to their elders, past and present, and extend that respect to all Aboriginal and Torres Strait Islander people today. So just to start, just a bit of housekeeping. So we're going to go through what the webinar is about today. So what is chronic pain, the symptoms and the neural pathways, how massage helps, the role of the allied health team and the nurses, and then at the end there'll be a question and answer session. So hopefully everyone can jump on and do their questions and answers through the chat. So we won't be having people speak during the session. Also, just to let you know that this is being recorded and it will be uploaded onto our website, which you'll see at the end, the website link, and that will be uploaded tomorrow. So, hi everyone, my name's Natasha, massage team leader, working with the wonderful multi and interdisciplinary Empower Healthcare teams. Everyone calls me Tash, as you can see in the slide. Welcome and thanks for joining me today to talk all things chronic pain and how we as massage therapists can aid in reducing pain for those at home in our community suffering. I've had over 15 years in clinical practice, spanning across aged care, sporting teams, elite athletes, and on the other side of it, palliative care. The last 5 years in particular, my work has been with aged care and palliative clients and their families in their homes. I have a really special interest in symptom management. As broad as that is, that's what brings the relief for clients. When there is relief for clients, their loved ones and carers also feel relieved. I also love management and leadership roles, connecting with team and supporting them in how they can best care and treat clients. Sharing of knowledge and experience provides for a great cohesive working team of professional clinicians. This is incredibly rewarding and brings great job satisfaction. So a bit about Tash, me, outside of work. I love my close family. My sisters all live in Tasmania. You can see them in the first slide. And I have a beautiful relationship with them. We're all athletes growing up. We catch up often either in Tassie or here in Melbourne. I'm married and have 2 children, my daughter in Melbourne and at university, and my son just retired from professional ballet and now living in Queensland, working in the corporate world with his Queensland Ballet Company. I'm an over-the-top dog lover, as you can see in the slide. I have 2 dogs, Chai and Murphy. They go everywhere with me, and I mean everywhere. They even get in my backpack for bike rides every now and again. We often head off in our caravan for weekends or weeks away on holiday, and I'll take my husband if he's good. So a little bit about who you are, who's out there today watching and part of this webinar, and what's your role. So I'd love you to send me a message in the Q&A or in the chat and tell me a bit about who you are, what is your role, which organisation you're from. You might be a carer, a client, a family member of a client, but it'd be really great to see who's joining us. So I'll just see, hopefully, some comments flooding in. Who we got? Yep. Excellent. We've got, we've got support coordinators, health coordinators, case managers. Wow. Support coordinators again. Quite a few case managers, care managers. More support coordinators. Yeah, fantastic. Yeah, clinical care managers. So yeah, fantastic. Awesome. Keep them flooding in because it'd be really good for us to see ongoing throughout the webinar who's linking in and who's a part of this chat today. So let's start with what is chronic pain. So it's the nitty-gritty of our session. It's all about chronic pain and how massage can help. So the definition of chronic pain does not require a medical degree to understand. It's any pain lasting longer than 3 months. So there are multiple sources of chronic pain, the 4 most common being lower back, which is quite debilitating and limits activity, cancer pain, which affects most people with advanced cancer, arthritic pain, headaches, the most common chronic headache being migraine, cluster and tension headaches, and other painful disorders such as neuralgias, which is a distribution of a nerve or nerves, and neuropathies, a weakness, numbness, and pain from nerve damage that affect nerves throughout the body and cause chronic pain due to the damage to the central nervous system through the brain and the spinal cord. Australians living with chronic pain. So in 2022, over 4 million Australians were living with chronic pain, and the prevalence increases as we age. 80% of the million were aged care residents. So with an ever rapidly growing aged population, this number is increasing at a rapid rate. So I'm sure many of you joining this webinar are health professionals, as we saw the comments coming in. And you'll notice that you'll be noticing that the rapidly growing aged care population not only is year by year, but actually it's so rapid that it's being noticed month by month. What makes you feel chronic pain? So your brain processes the signal and sends a message to you that it hurts. Simple as that. It's simple as that to say, but it's not simple in the clinical judgment. So The feeling of pain comes from a series of messages that zip through the nervous system. When you hurt yourself, the injury turns on pain sensors in the area. They send a message in the form of an electrical signal, which travels from nerve to nerve until it reaches your brain. And as we just said, the brain processes that signal and sends a message to you that it hurts. And chronic pain symptoms. So we often talk about learned neural pathways in relation to chronic pain. The nervous system is exceptionally plastic, meaning it can pick up habits easily, and pain is one of those habits. The more the nervous system practices activating a certain symptom, the easier it becomes to activate it again and again, and so the cycle continues. As the pain becomes chronic, many people experience sensitivity adjustment. The brain becomes more and more protective, detecting danger and triggering a pain response, even when there's no danger is present. At any point, an overactive nervous system can hit its tipping point and begin the cycle of chronic symptoms. These symptoms might arise from past injury, underlying pathology, or appear out of the blue. And common examples of symptoms for case managers and carers, family members, all of you out there to be aware of when referring massage, are things like migraines, knee pain, fatigue, leg and foot pain, back pain, anxiety, neuralgia, neck and shoulder pain, fibromyalgia, lingering pain from a past injury, hand or wrist pain. The symptoms ongoing, it's a huge list. There's more and more than, much more than I've just listed. But the thing to note is that these symptoms, when it becomes chronic, are symptoms that are ongoing for 3 or more months and then years. So another and simple way to understand and view pain is to look at Dr. Greg Lehman's The Cup metaphor. This helps us look at the big picture when planning treatment for pain. The cup metaphor suggests that pain occurs when all the stresses or loads in our lives exceed the space in our cup. When the cup overflows, we experience pain. So we as allied health clinicians can help. We can decrease some of the stresses and loads in the cup, things like stress, tissue damage, poor sleep, worry, fear, anxiety, and habits that are created. Many more things can fill our cup than that, though. So we can enable the client to build a bigger cup using strategies and methods to cope better. So pain is the balance between all of these things that are harmful to you, which is what's in the cup, and all the things that are good for you, which we can build a bigger cup. So exploring the benefits of massage therapy for chronic pain sufferers. So it promotes overall wellbeing and health, balancing the length and tension of muscles and tendons, restores correct positions, body positions, increases blood circulation, and it releases serotonin, the body's natural anti-pain chemical. So massage therapy is a highly sought after treatment for those dealing with chronic pain. The fundamental principle of massage therapy is to manipulate a person's muscles and soft tissue to promote overall well-being and health. Once the therapist has recognised the ideal type of massage for the client's specific needs, they will concentrate on balancing the length and tension of muscles and tendons, restoring correct positions, and increasing blood circulation. The practice releases serotonin, the body's natural anti-pain chemical, and can aid in the insomnia that often accompanies pain syndromes. And how does it help? How does massage help? So it's non-invasive therapy used to manage chronic pain. It's really important to note that massage therapy is not invasive therapy. It's used to manage, non-invasive therapy used to manage chronic pain. It's not a cure for chronic diseases or conditions, but with the combination of physical movement and tension and a treatment plan, massage is an effective treatment for reducing pain, relieving stress, and helps to change the lives of people that have been living with chronic pain for months and years. Massage for chronic pain helps reduce pain, tension, and stress, and increases relaxation and range of movement. During massage, muscle temperature increases due to an increase in blood flow. And when the muscle temperature increases, the elasticity and flexibility of tissues increase, and muscles are able to loosen and stretch. So from here, I thought it'd be a really good idea to give you a client case. And this is a client that I am working with at the moment, and also one of our physios is also working. So it's our interdisciplinary teamwork, work to help people that we care for. So how we at Empower work as an interdisciplinary team to help reduce chronic pain for our clients. And as I said, using one of my clients as an example. So the client diagnosis is Lewy body dementia. This is a disease associated with abnormal deposits of protein in the brain. And the symptoms are extreme muscle rigidity, decreased capacity to move, and rigidity and lack of movement causing increased pain. So as I said, an example, I'm working together with Empower's physiotherapist to help this particular client increase range of movement, strengthen and decrease his pain. In short, physio helps to strengthen muscles and massage helps to lengthen muscles. So strengthening and lengthening. The combination of both physio and massage enables the muscles to loosen enough to then strengthen and in turn provide movement and decrease pain. That is our plan. So our multidisciplinary teams here at Empower consists of these services at allied health professionals, ensuring the highest quality comprehensive care for our clients, participants and residents. So yes, when we talk about our clients, we often talk about the people in the home with them, or their carers, or their case managers, all a cohort of people that will help. So we're across Australia in Victoria, New South Wales, Queensland, and we have a WA team as well. So working collaboratively with our multidisciplinary team provides clients who suffer with chronic pain an improved quality of life, and even changes clients' lives through our clinicians planning the best care and treatments to reduce their pain. Together, the team at Empower Healthcare provides professional assessments and planned treatments for clients suffering from chronic pain. And so there we have physio, OT, nursing, OT occupational therapy for those that don't know, massage, osteotherapy, dietetics, speech therapy, podiatry, and allied health assistance. Our service coverage, it's probably best that you head to the website. So we offer massage in each state, which is what we're talking about today, but please check the website for the service coverage on the maps, and the website for the availability in your region. So the website here, www.empowerhealthcare.com.au. There's a client referral form on the website, waitlist request form, and rate card request form as well. And there's the number there if you need to contact us. So, having just talked and talked and talked, it's question time. So thank you so much to everyone who tuned in and joined me today. If you're in a position to refer a client or family member to massage for chronic pain, we can definitely reduce pain and help improve quality of life. So questions, if you'd like to fire away in the chat, and I'll try and get through each question as we go. Just bear with me. Yeah, here we go. Sorry about that little glitch. Do you have examples of relationship between massage therapy and positive outcomes in chronic mental health conditions? Yes, absolutely. Got examples nearly every day. So were you talking about chronic mental health? It's as basic as touch. So there's so many studies out there about how touch and massage therapy can reduce the chronic mental health, the pain and all associated with that, and anxiety, absolutely. And yes, that touch is so important, and it's not necessarily massage that's going to get in there hard. It's just about touch, and certainly massage therapists, as we are professionals, we know the areas of the body that are going to relieve that that tension and that anxiety. Great question. I've just got to thank you so much for sharing. Certainly learnt lots more about massage. Fantastic. That was the aim. What do I enjoy most about my day working as a massage therapist? It's huge job satisfaction. One, working with an interdisciplinary team so that we work for the best outcomes for our clients and work together on that. And leaving a client's house with, you know, smiles on their faces and having some pain relief is incredibly rewarding. So I'd say that that was my, one of my highlights. And also, and being a team leader as well, working with the rest of the team to care for our clients the best we can. Can massage therapy be included in an enhanced primary care plan? Yes, it can, absolutely. Massage therapy is a really good fit when there are other allied health teams or other services, other clinicians in there. So absolutely, it's a great. It just kind of fills the circle, if you like. And as I said before, we all work together to provide the best outcomes for clients. What are the qualifications of massage therapists? Do they always work in conjunction with physiotherapists? No, they don't. So the qualifications are, they're multifaceted. So it's a diploma where we're working with in the house, in the aged care setting. A diploma is needed for a qualification as a massage therapist, and some of us have a high level than that. We're myotherapists. Other people have different facets again that are multi-layered on top of their qualification. Working with physiotherapists, it's a fantastic thing to be able to do, and here at Empower, that is great that we can do that because, again, we're working for the client's best care. But no, on the outside of healthcare, quite often massage therapists will just work on their own. So highly recommend that massage therapists work alongside physiotherapists. What NDIS code would you charge under the remedial massage therapy for psychosocial disabilities? I'm really sorry, I can't answer that. I don't have the answers for that. It might be best to contact Empower, the number that was shown on the slide before, and I think they'd be best to help you. Sorry that I can't answer that question. Thank you for the presentation. NDIS will typically fund physiotherapy over massage therapy. May you please discuss some strategies to ensure better outcomes for participants to get massage therapy support? Oh, how we'd love that. Yeah, the strategies, I'm afraid, aren't going to come from us. I mean, we can keep putting ourselves out there as being really important and integral part of client care. But yes, you are correct. NDIS does typically fund physiotherapy over massage therapy, and let's work to change that. Let's increase that the number of people that on NDIS to receive massage therapy. Another question about NDIS, examples of how to justify massage therapy supports to the NDIS. Yeah, it's a repeated question. It would be so good to have more massage therapy with NDIS clients. Another one about pricing. I'm sorry, I can't answer that. That would be, again, the website or to call the number for Empower. There's a lot of questions about NDIS. I can see that it's a really needed area, much needed area. Do you have massage therapists in Leopold Geelong? I don't think we do at the moment, but we're always looking at different areas and where our massage therapists work from to enable us to link on another area. So hold that thought, it may come. Is there exercises or easy 15-minute practice at home parents can do for children on the spectrum of a night to make them more relaxed through the night and following the day? That's to answer that, it's really long and involved, but yes, there are. I'm wondering, are we able to get back to that question? And yeah, so yes, to the person that wrote that, it's a fantastic question, and yes, absolutely, we will follow that up and get in touch with you. I have a client who suffers chronic pain and has been waiting for surgery for many years. He is afraid of treating the pain out of fear of aggravation. What would you say to them? I'd say that massage is really going to help. And even, as I said before, even if it's just touch, and I don't mean it's from a professional perspective with massage, touch can be so many different things, and it can absolutely zone in on the area that we need to zone in on without it being, without it being too invasive. So we'll just go to our last question because we're running out of time. Is there a difference between skin contact and non-skin contact for the outcome of massage, especially on the back? I'm presuming you mean with gloves on, and absolutely no difference at all. In fact, quite a few of our clinicians, just for the safety of clients with open skin wounds or various skin irritations, it might be from medication or it may be from an illness that they're going through. Quite a few of our clinicians use gloves, and there is absolutely no difference for the clinician as when treating, and the benefits for the client? So another great question. Thank you. Okay. So we're going to wrap it up because we're just about out of time. We have our next webinar, which I'll get to, but meantime, just before I go, thank you all so much for joining me today. I've really enjoyed presenting. Have a wonderful afternoon. Those are in Melbourne. Stay cool. I don't know if it's cooled down out there yet. Hopefully the winds don't get up and we don't have any terrible bushfires, but have a fantastic afternoon. And we have our, whoops, sorry.
Let's go down to the first slide.
Where's that? Apologies. So we have our webinar on the 28th of May, 29th of May, I'm sorry, my eyesight's not that good looking at the other screen. And it's all about spinal health. So it'll be run by one of Empower's physiotherapists. So stay tuned for that and maybe mark it in your calendars and you'll be able to join, I think through the website, you'll be able to, like you did for this one, register for that. So have a fantastic afternoon and I look forward to chatting with you again one day. Bye.